Hey, what's going on? This is Brian from In the Trenches Ministry. Yeah, here I am again, trying to be all trendy and cool by doing it in the truck. And to be totally honest with you here, my family and I are in the middle of moving, and my wife is working nights right now. So I have a lot of back and forth stuff that I need to do, and I really wanted to get this video out, so here we are. So bear with me, this is going to be a first take kind of deal. This video is on treatment, okay? This is treatment for substance use disorders, including alcohol and other drugs. And before we get into it, I just want to cover a couple of things. One is, there's no cookie cutter way of doing this. There's no one size fits all with regard to treatment. It's really individualized. And two, because of that, there's just a lot of information out there. There's a lot of information that may be confusing and misleading. So I'm going to try to keep this as basic as possible. This is in no way, shape, or form meant to be a recommendation or suggestion or any kind of treatment plan for anybody. This is simply just some education. And so what I'm going to be doing is putting some links underneath the video so you can do a little bit of research on your own. And so yeah, let's get right into it. So we're going to do this from kind of a levels of care perspective, levels of care. And one thing I think we might all be able to agree on is when it comes to addiction and treatment and recovery, that it takes time. It takes a lot of time. And you might be familiar with the typical 30-day inpatient residential treatment program. And even before that, if someone comes into a treatment facility for substance use disorder addiction, the first thing they're going to most likely do is go through a detoxification, withdrawal kind of assessment. And that withdrawal, or that detox, I should say, can take anywhere from 3 to 14 days, depending on the individual, depending on the severity of the issue, depending on the frequency of the use, depending on the drug of choice or drugs of choice. So the detox, which is normally the first step, can take anywhere from 3 to 14 days. Now after that now comes in kind of that 30-day inpatient residential treatment program. And generally speaking, this would be the next step. Not always, but generally speaking, this might be the next step for somebody, where they're in a treatment facility for 30 days. They're in there day and night. They stay there. They don't leave. They have limited contact with family members and friends. Maybe no contact within the first week or so, and then even after that, limited. And this is just an opportunity for more assessment, more just understanding of the individual's use, abuse, and addiction. And during that time is when the treatment team will not only assess and treat, but also come up with kind of the plan for the next step. And if insurance allows, and if the individual is able to take advantage of the insurance or pay out of pocket, normally what's recommended after that is an extended care program. And an extended care program, that can take anywhere from another 60 to 90 days. And again, not saying everybody is going to go down that path. It's just been shown that, the longer somebody's in treatment, the better chances they have of staying in recovery. Okay, and so after that extended care, one might find themselves in what's called intensive outpatient treatment. And so now the individual transitions from actually staying in the treatment facility, and now they are getting back to some kind of maybe normal routine outside of treatment, meaning that, they'll actually go home at night and, come back in the morning. It may be anywhere from, 20 to 30 hours per week, something like that. And, that can be a 12-week program. It can be a 16, 18 week. It really depends on the treatment facility in which the individual is staying. And after that, after the intensive outpatient, normally hopefully what you'll see is some kind of continuing care program or plan for that individual. And this, this will take someone out to maybe a year or even more. So with regard to the levels of care, generally speaking, one will go through a detox period, maybe a 30-day inpatient residential treatment program, hopefully, if necessary, transition to an extended care program. After that, an intensive outpatient program, and then a continuing care plan. So you can see it's pretty comprehensive. It can be pretty robust and very helpful to the individual. And like I mentioned before, during the detox, withdrawal, and assessment, maybe that person was diagnosed with something that's more maybe mild or moderate, where the 30-day inpatient residential treatment program may not be necessary. So they might go into that, 12-week intensive outpatient, and then kind of just, go down in levels of care from there. So yeah, again, it really varies from person to person. Now, within that treatment process, you have all kinds of things going on. Like I said, there's detox, there's assessments. Now you get into the clinical counseling and therapy, even medication-assisted treatment, MAT. I'm going to be referring to medication-assisted treatment as MAT from here on out. And I'm not going to get deep into the weeds with that because there's a lot of stuff out there. And like I said, I'm going to put the information, some links in the bottom of the video. But MAT is a way for someone to, I guess, safely and a little more efficiently get through their detox. It is to help with the withdrawal symptoms from detox, and then it also is to help prevent further use and abuse. So it's kind of twofold, right? It's to reduce the withdrawal symptoms, and then to help with the further use and abuse of these substances. And just to kind of give you a couple to throw out there to get some names in your mind, for opiate and alcohol abuse, there is a medication called naltrexone, and this can be in pill form. Naltrexone's in pill form, and then the Vivitrol is an injectable form for alcohol and opiate abuse. And then you have Suboxone, which is an opiate antagonist or blocker for opiate use, right? And with any kind of medication, there's going to be side effects and things of that nature. I'm not going to get into the details about that. And there's other MATs for alcoholism. There's Antabuse, Camprol, and like I said, there's several out there. So I'll put some more information. Just know that MAT is, I think it's very important, because we can't treat somebody if they're dead, right? And so if we can attack the physical piece to this puzzle and keep these people alive, then we can start working on their heart, where the root of all this starts, right? And if we can work on their heart and get them to recognize some of their behaviors and I guess just thoughts and feelings and motivations for why they want to stop and how they think they should stop, then we're on the right path. Which brings me into the counseling and therapy piece, and again, there's so many out there, and I'm just going to really hit on maybe a couple. Cognitive behavioral therapy, which deals with the patient's thoughts, feelings, behaviors, and maybe some reasons why those behaviors became maladaptive, and then just ways to combat against those exercises that they can do. The therapist works kind of as almost like a coach, someone that can provide them ways, provide them tools to work through these thoughts, feelings, behaviors. So that's more of a counseling directive approach. On the other end of that, on the other end of the spectrum, you have what's called motivational interviewing, which is more person-centered. That I guess is more the counselor takes more of a passive role, where they encourage the patient to kind of look into their motivations and their drives for wanting to get well, just kind of diving a little deeper into some of the maybe things that they enjoyed before they were in active addiction. And again, so this is just a real brief overview of the MAT, the medication-assisted treatment, and then, of course, the therapy and the counseling. There are so many different ways out there, and you can even combine these. And so, again, I encourage you to check out some of the links below. This will help you kind of figure out a little more in detail what these are all about. But just understand that treatment, the levels of care, it varies from person to person, and it really it varies in degree. Again, how much or how long has this person been afflicted with this substance use disorder? What drugs are they using? The frequency? How sick are they? And then just the levels of care change as the patient hopefully begins to get well and understand that MAT is, again, in my opinion, a very significant part of early recovery, and it would be my hope that at some point the patient can get away from the MAT, get to a point of in their recovery where they are now again able to manage their life, able to kind of integrate back into society, become responsible, and just live a life of fulfillment. So, yep, that is a real quick overview of the treatment. Next video is going to get into recovery, or as I like to call it, discovery. So we'll talk about things like 12-step groups, AA, NA. What does recovery, discovery of oneself look like after they have been well for a number of months? Expect that to come up here in a little bit. Really appreciate you guys listening and watching these videos. If we can be of any further help, please feel free to reach out at any time. You can message us privately if you want. You can slap something up on the page, email us, whatever. We're here to help. We're here as a resource for you, your loved ones, and your friends. All right, guys. Love you guys. God bless, and we'll talk to you soon.